The patient I chose to highlight in my portfolio project, JR, is a pleasant 82-year-old Caucasian male who presents initially to the clinic for follow-up after a stroke in November 2022. Prior to his stroke, the patient and his wife report that he was totally healthy and active. They denied any preventative health care and stated that he did not follow with a PCP. His only past medical history to report was a right hip replacement in 2018. Following his stroke, he has been diagnosed with type 2 diabetes, hypertension, and hyperlipidemia. This patient was discharged from the hospital to a rehab skilled nursing facility where he spent almost 5 months. He was then discharged home approximately 2 months ago per his and his family's wishes. The patient presents to the clinic in a reclining wheelchair. JR is receiving home health care and physical occupational therapy 3 times a week for 3 hours per day. The patient's wife states that he's not following with any specialists at this time. His wife and daughter, who serve as his primary caretakers, express concerns regarding his ongoing anticoagulation therapy, feeding tube nutrition, and his insulin dose. They do keep daily blood glucose readings and daily blood pressure logs. JR's wife reports that his blood glucose levels are typically in the 130s fasting in the morning, and his blood pressure readings are usually in the 120s over 80s. His enteral feedings are managed by a dietitian. JR is able to eat a pureed diet as tolerated. JR also has a capped trach, which he has not used since leaving the hospital, as well as a Foley catheter. His wife and daughter provide trach care as instructed by respiratory therapy and Foley catheter care as taught by nursing during his hospitalization. I chose this patient for several reasons. Prior to meeting JR, my precepting NP provided me with a brief history and description of the care which he was currently receiving. She described to me the lengths his wife and daughter had gone to bring him home and care for him in order to keep him out of a long-term care facility. As a provider, I found his recent medical journey to be sad and frustrating due to his lack of preventative health care, but also encouraging and inspiring because of his family commitment and the teamwork between him and his family. Despite having major health comorbidities, which clearly creates obstacles for JR, his wife, and his daughter, they shared a common goal of optimizing his quality of life in order for him to remain present in the family's day-to-day life as he always had. The patient has one daughter who lives with her father, who lives with the patient and her mother in order to help them with his day-to-day care, one son, and 4 adult granddaughters who all live within 20 minutes of JR and his wife and daughter. It was important to them all that he be cared for at home versus remaining in long-term care. It was determined that the patient's wife would serve as his healthcare proxy because she is with him most of the time and knows his end-of-life wishes. JR does have notable aphasia for which his wife often finishes his sentences and thoughts. Often he speaks slowly, but he's able to verbalize his thoughts if the listener is patient with him. JR's wife and daughter would often answer questions regarding the patient and his care, but when the patient spoke up, everyone was patient and would allow him to speak. A lot of times he would nod or agree with them as they were speaking. JR and his family also stated that he had already had a living will and advance directive paperwork completed in the rehab facility which he was in for so long. They have provided the clinic with that documentation and it was placed in his chart electronically. JR, his wife, and daughter have goals that he will continue to remain at home while maintaining to adequately maintain his well-being, and that they follow with specialists which are necessary in sustaining proper care for him both physically and mentally. These specialists include neurology, pulmonology, nutrition, and dietary, and potentially endocrinology. He does plan to continue seeing the nurse practitioner as his primary care provider. Another aspect of the patient's goal would be to ensure that he maintains proper skin care to avoid skin breakdown or wounds as he adjusts to relying on others for assistance with position changing. The patient and his wife and daughter discussed how transportation has become difficult since he requires the wheelchair, and getting him in and out of the car has its challenges. They stated that they worry that he hasn't gotten as much care since he was discharged from the facility because of this obstacle, and they are happy to have referrals placed at the appointment with myself and the nurse practitioner. We discussed options such as utilizing the patient's insurance services related to transportation, as well as meeting with the clinic's patient resources liaison to determine if there are other options available. Potentially, the family could get a better equipped vehicle for getting his wheelchair in and out of the car. Interventions to ensure this patient's goals are met are determining a plan for assistance with transportation in order to ensure that the patient and his caretakers get to these necessary specialist appointments to optimize his health status. Having a proper skincare regimen in place, as well as a plan for assisting him with position changes that would help to minimize skin breakdown, leading to decreased quality of health or potentially hospitalization. Also keeping him from staying home, which is one of his major goals. At the patient's first visit, a hospital bed trapeze was ordered so that he could reposition himself without as much assistance more easily. He does have use of his arms pretty well and is able to pull himself with that trapeze. Another intervention discussed was that his wife and daughter were ensuring that either the patient himself or that they were providing adequate Foley catheter care. The importance of maintaining a clean catheter site was stressed to the family and the patient in order to minimize additional healthcare needs, appointments, or even hospitalizations. One additional barrier which was discussed with the patient and his family was that of caretaker burnout. This discussion was well regarded by the patient and his wife and daughter, and it was clear that they had already considered this obstacle and come up with a plan for it. They stated that the patient's son and granddaughters have been available to stay with the patient on a rotating schedule for several hours at a time so that his wife and daughter could have periods of respite from caring for him. They reported that this plan has been working well, and the patient even stated that he's enjoyed the extra time with his son and his granddaughters. We covered the Patient Self-Determination Act, which gives the patient the right to be an active participant in the decisions regarding his medical care. He stated that he understood this and had been the ultimate decision maker when he completed his living will and advance directives forms at the skilled nursing facility following his stroke. JR also stated that he chose his wife as his durable power of attorney for healthcare at that time, and those forms were also completed as well. The medical orders for life-sustaining treatment were also discussed. It was discussed then that he is aware that as a consequence of his stroke, he will likely face health obstacles, which will contribute to his health decline, which could ultimately decrease his life expectancy or how much longer he has to live. When asked if he was seriously ill or near the end of his life, how much medical treatment would he feel was right for him, he stated that he would value the quality of his life and his comfort over extending his life with uncomfortable measures. His daughter and his wife agreed that they just want him to remain comfortable in that situation as well. They all stated that they valued his quality of life over extending his life uncomfortably, and they know that when he nears the end of life, all of the family involved will support that decision. He stated he wishes to be surrounded by family members during the dying process. While he does still have a trach in place, the patient stated that he does not wish to have CPR performed should he go into cardiac arrest due to his complex medical situation and his advanced age. He stated he would also decline dialysis if it ever came to that. He and his family are not opposed to blood transfusions, artificial nutrition, hydration, hospitalization, diagnostic testing, medications, implantable devices such as a cardioverter, or even surgery should they help to improve his quality of life. JR did state that he did not want these interventions should he not have a chance at a good quality of life. JR did state that he does not want to be kept alive by mechanical intervention, or in the case that he does not have brain activity or an obvious awareness of his surroundings. The MOLST form was completed by the patient's wife and daughter and himself with his wishes. The importance of its use and necessity for revisions anytime his wishes change was discussed, and the patient and his wife, as his healthcare proxy, voiced understanding of the importance. JR's palliative performance scale is 40% based on his lack of ability to ambulate, his level of activity / evidence of disease, level of self-care, his oral intake, and level of consciousness. The patient's goals to have improved quality of life and to be able to remain in his home for as long as possible. Meeting with JR and his family was such a privilege. I gained so much insight into end-of-life care and planning. With this knowledge, I was actually able to present the information to my own family, my dad specifically, who has multiple comorbidities. We were able to get the ball rolling on his end-of-life choices by filling out his living will and advance directive. I'm hopeful to have this delicate conversation with many other patients in an attempt at improving their end-of-life planning and making them more aware of the options available to them, just as I have with JR. Although he did have an introduction to it at the long-term healthcare facility where he spent multiple months after his stroke, we were able to really go through each choice and option and make him more aware of his desires, as well as his wife's awareness of those desires and his daughter. Thank you.